So let's go. So we're going to start. Typically today we're dealing with approach to attention disorders, okay? So maybe even before I share this, let me share the objective itself. Attention and learning problems. Attention and learning problems. And then we'll go through the objective itself to know what does the objective want us to know so far as this topic is concerned. And remember that you can also download the objective. But if you download this one, it's just going to be this particular objective. Okay. Okay. Yeah. So it says that school and learning problems are among the most common reasons for children to present to primary care clinicians. And I see that all the time. Parents bringing their children on the recommendation of a teacher, right? Difficulties at school can be caused by treatable medical and developmental conditions, which, if unaddressed, can lead to long-term psychosocial dysfunction and chronic health problems. Causal conditions. Developmental disorders, for example, attention deficit hyperactivity disorder, that's ADHD, specific learning disorder, autism spectrum disorder, okay? So for example, if you go into the objective book, you realize that we've talked about approach to attention and learning problems. Now, what are the topics you need to cover? That is when you come here. And then you know that you need to cover ADHD, you need to cover specific learning disorder, you need to cover autism spectrum disorder, you need to cover hearing and vision impairment. You need to cover seizure disorders, fetal alcohol spectrum disorder, even other mental health disorders that can cause learning problems. Hunger, adverse child experiences, we call it ACE, right? So like trauma and all those things. And then obstructive sleep apnea, because during the day, the child is so tired, sleepy, cannot focus, that kind of thing. And then substance abuse and related and addictive disorders. So with this objective alone, you realize that you'd have covered 1, 2, 3, 4, 5, 6, 7, and even the mental health disorders. Only God knows how many topics you need to cover under that. Depression, anxiety. So let's even say that's even 1, 8, 9, 10, 11, 12. And even the substance abuse related and addictive disorders as well. So many of them, right? So by the time you are done with this objective alone, you'd have covered about 20 topics. About 20 topics, right? Now, giving a child or youth, doctors, please, are you following how to use the objectives to learn? I just want to make sure that, because I want to make sure that we are blending it and you really getting why we deal with specific topics. I don't just choose topics at random. I choose topics because they are critical. And if you have any question, please just ask me right away, because for me, it's very, very important. Okay. Now, given a child or youth with learning or social problems, the candidate will assess for potential causal conditions which often co-occur and will initiate an appropriate management plan. Particular emphasis should be placed on early involvement of interdisciplinary resources and longitudinal supportive care, right? I go on. Given a child with learning school problems, the candidate will list and interpret critical clinical findings, including those derived from a thorough medical and developmental history with a focus on potential causal conditions. Number 2, an educational history from school staff. So you realize that most of these conditions we are talking about, part of your evaluation is that you want to take a history from both the parents and the teachers. And I will take you, based on what we are going to study today, the assessment tools we use in Canada for such children. A physical examination with particular attention to signs of neurological or genetic causal conditions, okay? And then list and interpret critical investigations, including a systematic hearing and vision screening, relevant laboratory investigations like thyrotropin stimulating hormone, that's TSH, lead levels, psychological testing and behavioral checklist like ADHD screening tools. I'll be taking you there so that you understand it. And then construct an effective management plan, including supporting family advocacy for academic and or behavioral interventions at school. Okay, referring for interdisciplinary intervention if necessary, and ensuring medical management of causal conditions where required. For example, long-acting stimulant medications. It continues, providing counseling and longitudinal family support and referring for specialized care if necessary. So these are the things you need to know. So if you take almost the 12 or 20 topics we just talked about in this objective, these are the things you need to review. What are the investigations? How does the patient present? How am I going to take a history? Who am I going to take the history from? What makes this unique? What makes this case unique, right? How do I involve teachers? How do I involve parents? What are the screening tools I need? Because you need all those things in order to be fully prepared. So if you take fetal alcohol syndrome, you take ADHD, if you take, obstructive sleep apnea as a result of learning and attention problems, if you take depression, anxiety, that is what you need to do. Let's do this. So I need someone to read this first case for us, please.
Doctor, I can read.
Okay, please. Kindly read loudly for us, please, doctor.
Okay. A 7-year-old boy presents to the clinic with concerns from his teacher and parents about his inability to sit still during classes, excessive talking, and difficulty waiting his turn. These behaviors have been ongoing for the past 2 years. What is the most likely diagnosis?
Sure, please, everybody type your answers. Yes, please, go on.
Autism spectrum disorder, ASD. B, oppositional deviant disorder, ODD. C, attention deficit hyperactivity disorder, ADHD. And D, conduct disorder. So,
you know what, before we continue, I want to say something about the doctor who just read this case. He's one of the humblest guys I've met. The reason is very simple. This Dr. Idris, right? This Dr. Idris, right?
Yes, doctor.
No, seriously, I really like your spirit, and it is for one simple reason. You come to class like you are really, really focused. You are really, really ready to immerse yourself in. And that is what I've seen all those who get on to do very well in the exam. Like they come in, they volunteer, they are ready to. And he's done that consistently, very, very consistently. He's been with us for about 6 weeks, or I don't even know whether it's up to 6 weeks. And this has been his attitude. So doctors, please, I want to really encourage you that let's learn to go with that as well. Like it really surprises me. I've just paid attention and I'm really seeing that is the pattern. He really, really immerses himself in it. I'm hoping and praying that he'll do awesome so far as this exam is concerned. Okay, so everybody, I've seen that people are typing their answers. Dr. Idris, seriously, I really, really appreciate, the commitment you are making towards acing this exam. Okay, so the answer is obviously ADHD. That this one we are not going to even belabor the point. Why is it ADHD and why is it not autism spectrum disorder or any other thing? The answer is ADHD. This child exhibits core symptoms of hyperactivity and impulsivity, which are characteristics of ADHD. These include excessive talking, okay, inability to sit still, and difficulty waiting his turn, which have been persistent for 2 years. These behaviors are consistent with the predominantly hyperactive, impulsive presentation of ADHD. Now, autism spectrum disorder, rather, is characterized by difficulties with social interaction and communication. Difficulties with social interaction and communication. Oppositional defiant disorder involves a pattern of defiant and oppositional behavior, while conduct disorder involves more severe behavioral problems such as aggression and rule breaking. So why is the answer ADHD and not any of that? Because this child is exhibiting characteristics of ADHD like hyperactivity and impulsivity.
I'm reading.
Okay, please read.
A 9-year-old girl is described by her teacher as frequently daydreaming in class, often losing track of her school supplies, and failing to complete her homework. Her parents note that she is easily distracted at home and often forgets her daily chores. What subtype of ADHD is most likely? A, predominantly inattentive, B, predominantly hyperactive, impulsive, C, combined presentation, D, oppositional deviance disorder.
Beautiful, 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 beautifully read. Thank you, doctor. So, somebody who keeps on daydreaming, losing track, failing to complete school homework, distracted at home. So now we're also drawing your attention to the fact that there are subtypes of ADHD, right? Which you must also know. We've learned how to diagnose ADHD itself. Now we are learning the subtypes of ADHD. So it looks like everybody is going for A. Those on Facebook, what are you going to go for? Are you going to go for A or B or C or D? What are you going to go for? And the answer is very simple. It's A, predominantly inattentive. This is a child who is daydreaming, losing things like Dr. Brony does. Okay, so the child's symptoms, including frequent daydreaming, losing track of supplies, and failing to complete tasks, are indicative of the predominantly inattentive presentation of ADHD. So there's an inattention part, there's a hyperactive part. But this child is presenting with a predominant inattentive state. This subtype is characterized by difficulty maintaining attention, forgetfulness, and disorganization rather than hyperactivity and impulsivity. So that is what makes this question. The answer is A. So next question. Who wants to help us with this one? Please, doctor. Who wants to help us?
I will.
Okay, please, doctor, let's go.
A 14-year-old adolescent with ADHD presents with new concerns of increased risk-taking behaviors, including substance use and reckless driving. Which cause symptom of ADHD is most likely contributing to these factors?
Beautiful.
So for these behaviors, A, hyperactivity, B, inattention, C, impulsivity, D, social withdrawal.
And before you move on with your answers, Dr. Victor Kulawole Benro says, I'm loving this class. He's joined us on Facebook. So please, you can also send the Facebook link as well to your friends, okay? So that they can also join from there. So is it hyperactivity, somebody who has reckless behavior, substance use, increased risk-taking behavior? Is it hyperactivity? Is it inattention? Is it impulsivity or social withdrawal? What is it?
Impulsivity.
Doctor, sorry, what did you say? Sorry, someone gave an answer. Okay. So impulsivity. Yeah. So it looks like that is C, right? Okay.
Yeah.
That is C. Yeah, because of the fact that he just does things like, why should you do reckless driving? Impulsivity is a core symptom of ADHD that persists into adolescence and adulthood. Okay? It often manifests as risk-taking behavior such as substance use and reckless driving. Hyperactivity tends to decrease with age, while inattention may contribute to academic difficulties, but is less directly related to risk-taking behaviors. Social withdrawal is not typically associated with ADHD. So let's learn some learning points as well. This patient is exhibiting impulsive behavior. Hyperactivity tends to decrease with age, because as you grow, you mature, you learn some social things to balance things. Even though you may still have the hyperactivity features, they may not be as strong as when the person was a child, right? Yeah. And then social withdrawal is not a typical association with ADHD. Okay, good. So now, next question. Who will take this for us, please? So the reason is because I'm testing your knowledge, then we go into the lecture just to re-emphasize and reinforce the things we did not know before the class. And I've seen that this really helps candidates to appreciate. I don't know whether you're okay with that or you want us to rather go through the lecture and solve questions. Which one do you prefer? Do you like it this way where you test yourself before we try the questions, or you want it the opposite way? Doctors, let me know.
Like it,
whatever it is you want.
Yeah, we like it this way.
You like it this way? Awesome.
Yes.
Okay.
Yeah.
Okay. All right. So it looks like everybody likes it this way. So I'm going
Can I go for it, doctor?
Doctor, please, let's go. Yeah.
Okay. So which of the following statements regarding the evaluation of ADHD in children is true? A, ADHD symptoms must be present at least two settings, for example, home and school. B, ADHD can be diagnosed based solely on a single clinical visit observation. C, ADHD symptoms must be present for at least 3 months to establish a diagnosis. D, a response to stimulant medication can confirm the diagnosis of ADHD.
Beautiful.
So the answer is A.
Okay.
ADHD symptoms must be present in at least 2 settings, for example, home and school.
Beautiful. Beautiful. Does anyone have any counter argument? So ADHD symptoms must be present at least 2 areas. So, it looks like this is very simple for us and we're not going to deal with it. Now, to meet the diagnostic criteria for ADHD symptoms must be present in more than one setting. More than one setting. That is why I've been saying over and over again, you need to get information from both teachers and parents, okay? And I think Dr. Jenia also said she goes with C. Dr. Jenia Maria is joining us on Facebook as well. And she says that she also prefers this approach. So it looks like everybody likes this approach. So we'll continue that way. We do what helps you, okay? And it persists for at least 6 months. Diagnosis cannot be based solely on observation during a clinic visit, as symptoms may not be apparent in a structured setting. A positive response to stimulant medication does not confirm the diagnosis, as these medications can improve behavior in children with conditions other than ADHD. So, yeah, that's also something you want to really pay attention to, right? Okay, good. Now let's try this question as well. Who wants to help us, doctors, please? Who wants to help us? Who wants to help?
Okay, go on, please.
10-year-old boy with ADHD presents with difficulty making and keeping friends. He often interrupts others during conversations and intrudes on group activities. What is the most likely reason for his social difficulties?
Dr. Ruth, before you continue, your accent, you sound Ghanaian.
Yes.
Okay. Awesome. Okay. So read the answer questions for us. Read the answers for us. That's good. I'm able to pick up accents now.
You are. All right,
Yeah.
thank you. A is academic underachievement, B, hyperactivity, C, impulsivity, and D is inattention.
What is the answer?
Impulsivity.
What? Impulsivity. Doctors, does anyone have a different answer? Impulsivity. Okay. So that's what we are going for. Facebook gang, Dr. Jenna and the rest, I've not seen your answer yet. So please, kindly put your answer. But the answer is impulsivity. Impulsivity in ADHD often leads to difficulties in social interactions as a child may interrupt others, okay? So when you're having a conversation, the child keeps cutting in, even when there's a class, the child does not allow others to speak, just speaking above everybody, not very good. While inattention and hyperactivity can also contribute to social challenges, the specific behaviors described are more closely linked with impulsivity. These questions provide a mix of clinical scenarios that test understanding of ADHD's core symptoms. Let me see if there's another question. Okay, so this is about treatment. So what we'll do is that let's jump into the PowerPoint, review the notes on etiology, presentation, epidemiology, and all those things. Then we come back to treatment and its complications, all right? Now we solve some questions before we go back to treatment and its complications so far as management is concerned.